The first thing that's really important is to understand just the level of expertise that the APPG longevity program has brought to bear. Listening to the richness of debate at a recent session, you left with no doubt that the right people with the right perspectives and right understanding are contributing, which I think is absolutely fantastic. I think the second thing is that the consultation period has driven through and has started to indicate some really clear themes. And what struck me from that was really the complexity that we're dealing with and the complex set of drivers and levers that are going to need to be delivered to effectively impact 5 years extra healthy life by 2035. It's really not just about health and housing and education. It's a whole raft of things working together. It's a real ecosystem. And I think the last thing that really strikes me is this is just the start of the journey. 16 years away from the target. There's a lot to do, a lot of work, and we need as much support and input as we can get.
Is there anything you've learned to date from your role with the APPGL that surprises you?
Yes, there was one hard piece of evidence that really did strike a chord with me. For many years, we've known it's far more effective to prevent illness than to treat. But for the first time, I heard about a hard number in a recent meeting, which was the relative cost of treating somebody in the primary care setting as opposed to the acute setting is 25 times the cost rate, 300 versus 9,000. And that really strikes. And for me, that means what we're doing has real validity.
Prevention and giving the patient more control over their own health, that's the way forward, clearly.
Absolutely, without question.
What do you see as the biggest challenge?
I think biggest challenge is timescale. A lot of the discussion to date has been around on the importance of, if we take digital and technology, a lot of work around analysis, and that analysis starting to understand the impact on longevity from early life. But actually, we've got multiple drivers. We've got to continue to deliver a health service that is efficient and effective today. We've got to move forward and deliver a better understanding of the needs of the health of the population. But we've also got to deliver better quality of life for people like me. I'm 55 now. By the time that 2035 comes along, I'll be 71. And I'm one of the people that really needs to change the way that they think about and interact with society to have a much more effective older life.
In what ways are you thinking personally you're going to have to change? Because you've got the inside line on all of this, working as you do on the digital transformation to address the healthcare and other challenges that are inherent in our rapidly aging differently population.
Indeed. I mean, I think for me, it's at the heart of it is, and technology has clearly got a massive part to play as an enabler. But if I take it right down to the bottom, what this is for me is about a cultural shift from a national health service that's a treatment organisation to a context that's much more about our collective wellness, for how much longer we can be effective and productive. And for me, that's about taking control of my own health as opposed to expecting the health service to do that for me. So it's about creating, really, I'd call it a wellness record as opposed to a health record. It's about how I live, how I eat, how I sleep, how I look after myself, how I interact with others. All of those can have technology implications, but really it's about that shift from being a recipient to the person that owns their own health.
You are a sponsor of the APPG for Longevity. How is your company, Gemserv, helping you and me and everyone else achieve this?
We're working at 3 levels. The first level is we continue to work closely with customers like our customers on the Isle of Man, where we're re-engineering their healthcare system to drive out day-to-day operational efficiency and outcome for patients. So healthcare provision today. We're working with a number of other organisations to help them create much more holistic health records across geographical areas away from traditional care settings so that they can start to really understand the needs of the population. And then at the third level, we're doing things like this. We're sponsoring the APPG. I think it's an immensely important thing to do. It's going to define healthcare for not just for the next generation, but generations beyond that. And so we're really looking closely at how we can take some of the learning of transforming the energy industry, which was where the business was born, into transforming the healthcare sector and really putting the patient at the heart of design of healthcare.
Now, your corporate tagline at Gemserv, David, is "We make things that matter work better for everyone." What in the lineup of the things that you're making now excites you most?
The most important thing for me is, and actually it's the underpinning of that strapline, is making a difference. And as an organisation, we look at health and look at the reality of getting older, more complex conditions, and the deterioration in many cases today of the outlook for the older population, and to be able to make a difference to that journey for the population is it's what gets me out of bed every morning.
Thank you so much, David, for speaking with me.
Pleasure.